Good afternoon from number 6 Convent Place to another of our daily updates on COVID-19. Today, Sunday, the 26th of April, 2020. Need I remind us of the year? I'm joined today, very pleased to be joined today by our hardworking, tireless Civil Contingencies Coordinator, Iva Lopez. Hi, Iva. This is the 41st time since the pandemic began that you may have tuned in at 4 p.m. to GBC for an update on the COVID situation. It's in fact press conference number 39, as we had the Easter messages by His Excellency the Governor and the Chief Minister during this time. I think that most of us by now know that we are still learning much and still have much to learn about this virus and the disease it causes, COVID-19. This last Thursday, just a few days ago, together with Minister for Health and Care, my friend and colleague Paul Balwang, and Director of Public Health, Dr. Sohail Bhatti, and Dr. Krish Rawal, GHA's Medical Director, and thanks to Dominic Searle, our London representative, who also facilitated it, we had the second of our video conferences with Professor David Heymann. Professor Heymann is a recognized world expert on infectious diseases, public health, and global health. Previously, he was a World Health Organization's Assistant Director General for Health Security and Environment and representative of the Director General for Polio Eradication. For a number of years, he was Executive Director of the WHO Communicable Diseases Cluster, during which he headed the global response to SARS. And prior to that, he was Director for the Program on Emerging and Other Communicable Diseases. He also worked in Africa on Ebola and in India on their smallpox eradication program. He's currently Professor of Infectious Disease Epidemiology at the London School of Hygiene and Tropical Medicine and is a member of several WHO advisory committees. Once again, it was a very useful meeting in which we were able to discuss Gibraltar's strategy and at the same time learn about current developments firsthand. It was a privilege to spend time talking to such a recognized expert and to gain direct information at WHO level. Professor Heymann confirmed that there are still many unanswered questions on community spread and immunity in particular. People with mild infections do not have much by way of antibodies detectable by current tests. I'll share some more of our conversation because I think it's generally of interest. He reminded us that there are 4 well-known human coronaviruses which cause the common cold. Then there are the 3 new ones: SARS, which was virtually eliminated, MERS, which still occurs in camels with occasional transmission to humans, and SARS-CoV-2, which is a virus that causes COVID-19. This is one which, as we have seen, sadly, does pass from human to human more easily. However, due to this lack of detectable antibodies, we are still not clear about the extent of community transmission, which is one of the reasons why we have to take all the precautions that we know we have to take. It is becoming clear that this virus can be contained by maintaining distance and the other well-known methods like washing hands, using gel, catching sneezes and so on, in a way that the flu cannot be contained. And he did stress that this coronavirus does not spread as easily as influenza. The following day, after our virtual meeting, on Friday, he was attending a WHO meeting at which the latest advice on immunity was going to be agreed. And we got a fascinating preview of it. In fact, that document was released by WHO only yesterday. Once again, although not going as far as stating that you definitely will catch COVID twice, the kind and extent of immunity you gain when you overcome it is not clear. That is, you don't get an immunity passport once you've had it. And so even if you have had it, you still have to follow all the guidelines. We were able to discuss the matter of masks, and he summarized the position based on the latest evidence. He confirmed, as I think most of us know, that the wearing of masks stops the wearer from spreading the virus, but does not necessarily protect the wearer significantly, him or herself. Therefore, it's recommended in enclosed places where full social distance cannot be maintained in order to reduce the spread, especially by those with the virus but without symptoms and those accessing vulnerable people through age or condition. But, and I repeat, it does not significantly protect the person wearing the mask. He did confirm to us that testing in UK of the so-called Oxford vaccine had begun. Because it's based on an existing vaccine already used on humans, the process to develop it can be quicker, as it doesn't first have to go through the process of testing on animals. We will have to wait and see how successful it is. Once again, Professor Heyman stressed the importance of a healthy lifestyle and of the need to work more in the future on preventing poor health and not just in health services that treat illnesses. Professor Heyman was complimentary about the steps that we've taken in Gibraltar and our successful strategy so far. Like we do regularly, he warned about complacency and stressed that we need to keep reminding ourselves of the danger that this virus still poses. This is something that the government has very much in mind as it discusses and considers next steps. Rest assured that every aspect is being considered based on public health advice and conscious of the need of getting our lives and our economy back on track as soon as it is safe to do so. You will be hearing a lot more about this very soon. I can tell you that in my own department, we're looking at ways in which we can safely re-engage in any areas where we may have been pausing. So we're looking at ways of reopening the museum and libraries as well as exhibitions and other aspects of our rich cultural life. We will be talking to dance schools and academies about this in the next few weeks. Indeed, as the Deputy Chief Minister said on Friday, we've been working through the weekend on producing a plan which we will be discussing at Cabinet tomorrow and which, when agreed, will be published very soon. And now for today's figures. At Accident and Emergency in St. Bernard's Hospital, in the 24 hours to 8:30 this morning, there were 26 attendances. Of these, only 4 were of persons with COVID symptoms. All 4 were swabbed, but there was no need for any admissions to either of the COVID wards, John Ward or the COVID CCU. In relation to hospital, there are no patients in the COVID John Ward. There is 1 in COVID critical care unit, but it's a patient who has since tested negative and so will be moved. So there are no COVID patients currently in our hospitals. The latest test results are not quite as reassuring. Total swabs, 2,198, pending 82, results received 2,116, and confirmed 141 cases, active 10, recovered 131. This represents an additional 9 positives in a week after a lull of about a week with no increase. While these are clearly still not massive numbers and certainly nothing to panic about, they do act as a sobering reminder that the virus is out there still. And we need to think about this. Did we drop our guard over Easter weekend? Or last weekend with the glorious weather? Are we getting overconfident and giving the virus another chance? These are all questions we must ask ourselves. If we want to transition back soon, we must not drop our guard. We must be more aware than ever and act accordingly. We must keep distance. We must wash our hands. In workplaces, in particular, we must keep surfaces clean. And now, in order to update us with much that is going on, so much work by so many people to whom we must all be so grateful, I hand over to Ivar Lopez. Ivar.
Thank you, Minister. Good afternoon, everyone. And I believe my last press conference was on the 19th of March, which was actually just in between the announcement of the lockdown that we had for the over 70s and the general lockdown that we had. So much has actually happened since then. At the time, I very much covered the command structure that government had implemented, and I think that I covered responsibilities during that time. So my aim today is very much touch upon the journey that we had prior to the lockdown. I will then focus very much on the work that these teams have been carried out, and as the Minister said, they have done exceptionally well in terms of pushing forward with stuff that needed to require. And then I'll finish off with very much looking at, with an eye for the future. As I think I mentioned last time, the work for coronavirus preparation very much started on the 20th of January when we had our initial meeting. At the time, it was when the World Health Organization had been notified about the cases in Wuhan, as we were aware, and we could have already seen how the situation was developing across the world. On that day, on the 20th of January, when government met, there was only 282 confirmed cases worldwide, many of whom were in China, about 278, and there were one or two cases confirmed in Thailand, Japan, and Republic of Korea. That was it. By comparison, today, globally, there is over 2.9 million confirmed cases, and there has been over 203,000 deaths. We know that the United States of America is currently the country with the most confirmed cases, just shy of 1 million itself, of which there has been over 53,000 deaths. And we well know that back in UK, there's nearly 150,000 confirmed cases already, and over 20,000 dead cases. In Spain, 223 confirmed cases, and over 22,000 deaths. So we can see how much things have actually changed in the last 3 months. When we had our initial meeting, we set up the government set up a strategic coordinating group, and that was very much chaired by the three ministers. Minister Sacramento as Minister responsible for civil contingencies, Minister Cortés responsible for public health, as well as Minister Balban for health. And we know that in the days following that event, on the 30th of January, the World Health Organization declared the COVID outbreak a public health emergency of international concern. Gibraltar published its first regulation by making COVID-19 a notifiable disease. That was on the 31st of January. And on the 11th of February, that is when we started the first of the many regulations that was made under the Civil Contingencies regulations, of which there have been approximately 30 regulations made under the Civil Contingencies Act. The initial focus at the time, as we know, was very much controlling our points of entry. We were concerned at the time that the influx of people coming from the specified country, mainly China, but also in the region. So I think much work was very much focused on controlling the tourists that were coming through the land border, through the airport, whether that was your workers that had been in China coming back, or indeed other tourists or crew members coming across to the ships. And indeed, there was much engagement during that time with the Borders and Coast Guard Agency, the Gibraltar Port Authority, as well as the Gibraltar Tourist Board, in making sure that we were able to control the influx of people from specified countries. At the time, regulations really focused on isolating these individuals that were coming into these countries and making sure that we were able to carry out tests at the time with those that were displaying symptoms. But much of that, as we all well know, really changed when Gibraltar registered its first confirmed case on the 3rd of March, and really the pendulum then swung in terms of the approach that the Director of Public Health, together with government, pushed forward with that. Indeed, the World Health Organization declared a pandemic on the 11th of March, and during that time, the advice from government in terms of self-isolation changed on the 16th of March, with the over-70s lockdown that I mentioned coming into play on the 17th of March, and the general lockdown coming in force on the 24th of March. So during all that time, we have very much continued to prepare, making sure that where we had to address areas, government has been able to address those, but also responding to the cases. So I think that very much covers the journey that we certainly had to the lockdown, and what I will now want to touch upon is the work that the teams have been continuing with. First and foremost, I'll cover the actual command structure that has been implemented, other than the fact that we were already meeting together for the planning preparation by the end of January. Gibraltar very much declared COVID-19 a major incident on the 29th of March. That very much resulted in the structures of Platinum getting together, likewise with the strategic coordinating group, which is chaired by Minister Sacramento, as well as the GHA's Gold and Silver Command coming into force. And since then, we have been in very much into a daily rhythm where situation reports are required to be produced on a daily basis, and meetings are very much being held on a daily basis. What we'll now touch upon is about the work that the teams have carried on or carried out. Firstly, I think I will touch upon the Gibraltar Health Authority, given that they are the lead agency in terms of our being responsible for the medical support that they need to provide. I know that yesterday Minister Balban gave an overview on all the areas that they have been looking or progressing with, but certainly there has been great work from St. Bernard's Hospital in terms of increasing that bed capacity, where we currently have 760 beds, which is an incredible increase, and that is very much thanks to the work of the GHA staff. There's been much work as well in terms of the testing facilities. Bear in mind that it started with tests going across to Public Health England in Colindale, as well in Spain. But now, as we're well aware, Gibraltar has its own testing facility, both in the PCR and also in terms of the fast swabbing that the Genie products have been able to do. And much of that we also need to thank Dr. Nick Cortez in UK, who has been supporting our GHA staff over here. The 111 service was key to the work that COVID-19 had to do. And again, the operators that have been working under Dr. Elaine Forrest have done exceptional work to make sure that we are supporting and tracking GHA, looking at all the people who have been affected with COVID-19 or potential suspects. Much development has also seen GHA producing the CT scans, and now they are very much providing digital autopsies, as well as increasing the medical supplies and personal protective equipment that, as we know, the whole world has seen shortages of. But again, they've done marvelous work in making sure that our supplies over here are in a healthy state. There is still a lot of engagement with the National Health Service in UK, and you may have seen recently as well that they are currently creating a contact tracing app, which again Gibraltar is very much engaged with the UK, and I'm sure that that will come soon to us. Much of GHA's work, though, really featured around the Europa Point Hospital and making sure that we had an extra facility for up to 300 beds. And at the moment, we have 238 beds that are very much set up. And again, I must thank the work that all the GHA staff have done, but particularly as well Stuart Benson, who drove with that project with only 2 weeks to go, and make sure that everything was set up for us to have that capability available for us. It was a huge logistical challenges, not only getting the medical equipment in, but also the provision of oxygen supplies to the event, and the fact that we have such a facility, I think, is tantamount to the great work that everyone has been involved with. Also have to touch on the ERS services and the great work that Susan Vallejo and Dr. Mena have been doing over there, not just in making sure that they are protecting our most vulnerable over there, but also creating the isolation facilities that they have done in every of the facilities that they have. So again, it's looking back within the short period of time, their achievements have really been remarkable. Much of the COVID work is about vulnerable groups, particularly the over 70s. And the creation of the vulnerable group team under Wayne Barton has very much pulled together all the work from the ERS, the care agency, the housing departments, and making sure that they are providing the support that they can, not only to the over 70s, but people who may be homeless, the children, as well as people that may be affected through domestic violence as well. And that team continues to work hard to make sure that all the people's concerns are addressed. There's also been the requirement to support people, particularly those registered with the care agencies, the over 70s families that needed the help from government. And the teams under Dean Castry have been able to support over 279 requests for 110 vulnerable families. And that has meant daily engagement with them, making sure that they are receiving the goods and the items that they do. And again, I congratulate the team for working so hard in making sure that the most vulnerable of our society are supported. Much of the work, though, will not be able to be carried out with the support of our own volunteers. And the great work, again, the over 1,000 volunteers that stepped forward to provide assistance to government, that was very much initially created by David King, but we've had Lisanne Peralta very much leading and managing the teams there. Remarkably, they have supported over 800 requests so far. We've got over 1,000 volunteers, most of them which have or who have been vetted, and they've actually implemented apps to assist them in the delivery of these items and getting control. So again, great work, and that has meant 24/7 support since we very much started this project. I also must thank the other volunteer groups that have been operating separately. I know that many of you know who they are, and again, they've been across from every sector of society and playing a vital role in terms of that wider support. And I do really thank everyone involved, as well as the recent donations that we had from iPads that have gone to the vulnerable children. Other part of the work that government has set up has been the mental health and psychosocial support group, and the work has been carried out under Giselle Carreras, where they have been delivering frontline resilience management to our frontline staff, mainly of the GHA, but other members of the emergency services, education staff, and even the call centre operators, supported by Sean Keating, Alfred Rovegno, as well as Shane MacDonald. The team have been working non-stop to ensure that that key part of support has been able to be delivered. Equally, Giselle has been working very closely with all the other agencies, making sure that Gibraltar has been able to provide the wider mental health support to all members of the community, and that work continues. I touch upon the Public Information Call Centre, 200 41818, as we all know. That has become the one-stop shop for all non-medical COVID-related concerns. And again, we've seen over 3,000 calls being handled by the centre, where they have been able to support members of the public, either by delivering the products or indeed signposting them to areas of mental health. What I will, however, reiterate is the fact that the 200 41818 is very much a number for COVID-related non-medical. If it's medical, it should go through the 111. But also it is important to note that any emergency calls needs to be diverted straight to the 190 or the 199. Okay, and again, thank all the call centre shift workers over there that have been working round the clock to support all members of the community. Much of these works have only been possible by making sure that we've been able to draw personnel from across government, from the public service as well as the civil service, to support each of these teams. And the work that the Public Service Strategic Support Group has done by combining all the human resources managers together to ensure that they are reassigning people where they're most needed, again, has been exceptional. And again, thank Richard Montado and Microchrome, who have been leading with that, together with all the other human resources managers. We know that COVID-19 has affected businesses, certainly as a result of the lockdown, and the work that government has done in terms of creating the CELAC advisory group, which has been led by the Chief Minister together with the Ministers for Finance and Businesses. That has allowed the Business Support Group to support these businesses, either through the BEAT mechanism, as well as allowing permits where these have been authorized by the group. So far, we understand that over 1,300 of these queries have been handled by the Business Support Group, and they continue to engage in supporting members of the community. Another area which has been quite important for COVID has been that of the work that the Ministry of Environment has carried out. And under the leadership of Dr. Liesl Massilio, they have been very much engaged in making sure that food supplies continue unhindered, and that has meant engagement almost daily with all the food suppliers, whether those are the supermarkets or the wholesalers, and that engagement has really started since late January or early February and really continues. And the fact that our shelves continue to be full, as we all know, I think just shows the work that they have been able to carry out and how useful that has been. Another area of the Ministry of Environment has been about increasing the cemetery capacity, and they have actually done great work in making sure that we are able to receive further demand over there if it is required. And lastly, the work that they continue to do in the whole waste management and disposal, which is so key to COVID-19, again, has been remarkable thanks to the work of everyone involved. In terms of the media office, we know that they have been key in terms of pushing out the public messages out to everyone concerned, but equally the fact that they have been running the public conferences, the press releases on the daily basis, as well as answering the questions and carrying out features with a small team, I think just shows the hard work that has been put in by that team themselves. We've also had much support from the whole ITLD department and GIP Telecom in providing command support, whether that has meant an increase of IT equipment or indeed allowing people to work from home, as well as much work that has been carried out with the geographic information system, which has been developed to assist the Director of Public Health in getting a better understanding of the disposition of our most vulnerable within the community. And that work continues, and again, I am very grateful for everyone concerned. I did mention earlier about the legislation that we've had over 30 pieces of legislation concerned with the Civil Contingencies Act, and that work has very much been led by Paul Peralta together with Nadia Cicerello and Kevin Warwick in making sure that they are able to turn around and deal with things as and when they are required, and that certainly has meant pushing stuff out very, very quickly. The essential services are playing a key role, as we all know. Not only have they had to adapt in terms of the support that they need to provide to the community, but also the fact that they still need to maintain that resilience to be able to deal with any issue or any other incident that may occur. And I think that the work from RGP, the Gibraltar Fire and Rescue Service, as well as the ambulance in supporting us through this has been very important. And certainly there are weekly meetings taking place to ensure that all the areas of concerns are addressed and that Gibraltar continues to be prepared not only to deal with COVID-19 but with all the other incidents. I must also thank all the other uniform bodies such as BCA, HM Customs, the Prison Service and the Gibraltar Port Authority for providing that extra support not only to the emergency services but equally to other departments in government as we push forward with this. Critical services have also been very important for us in terms of electricity, water indeed telecommunications, and the work that the Technical Services Department are doing in making sure that they are providing that support has also been quite important for us. Nearly finished, but I must thank British Forces Gibraltar for engaging with us back in March and providing us the military support that has been so welcomely received. Whether that has been the regiment in providing the general logistical support and making sure that we were able to open the Europa Point Hospital on the days that we needed, but equally the support that the military medical teams have also been providing to the Gibraltar Health Authority has been quite important. This has meant that we've had close liaison at all levels, whether that is CBF, which Command of British Forces working at Platinum, the fact that we've had liaison officers embedded with us in the Office of Civil Contingencies with Major John Pito, as well as the Principal Medical Officer, again embedded with the Gibraltar Health Authority. And the reason that that has actually worked well is because we have been able to work quite closely together. There has been much work too that the Foreign and Commonwealth Office has done, certainly across the road from the convent, not only in the engagement with the other British embassies, as some Gibraltarians have been stranded across in other countries, but equally making sure that we are able to tap into other UK government departments, whether that is Public Health England, the NHS, or indeed any other government department that we will require that support. And finally, I will touch on the Office of Civil Contingencies, because that team has very much been providing the support between all the other teams, and certainly Ernest Danino has been engaged very much with the convent, making sure that all the Gibraltarians who have been stranded across in other countries have been supported, and making sure that we are able to recover them as quickly as we can. Likewise, engaging with the Moroccan Community Association, which I'm really grateful for their assistance. Also the work that Brian Brooks has been carrying out together with the Borders and Coast Guard Agency to make sure that we've had that flow of traffic from the border and making sure that we are able to support those teams. Without them, obviously, much of this will not be able to work as smoothly as it currently is. I think that's probably given a quick rundown. There certainly is a lot of other departments I haven't even mentioned that are working very hard through this pandemic, whether that is the Department of Education, indeed many others, but have just very much focused on those teams that have been created specifically to deal with COVID-19. The last thing I will just mention is very much about the future, and that is very much that COVID-19 is here. It has not gone away, as we all know. So at the moment, it is very much important that we are able to respond to any spike that we have. It is therefore important that the people continue to abide by the guidance that is being issued, and therefore they are to respect the distancing rules, as well as making sure that they are following the wider guidance, such as washing their hands and so on. It is important that we keep an eye on the future. Certainly I know that government will be very much working towards the project of restart and recovery, but that will take time, and that will be very much a staged approach as we are able to lift restrictions. But as we said, at the moment, the virus is very much here, and we need to be prepared to deal with that. Minister.
Thank you. Thank you, Ira. So many people doing so much. Gibraltar really has come together. Of course, we remember all those doing their day-to-day work from home or from the workplace, keeping Gibraltar ticking. We thank them all. Now we have some press questions. So over to our friends from the press office.
Good afternoon. The first question is from GBC. What is the government's strategy in the coming weeks? Is the goal to stay within GHA capacity while 60 to 80% of the population is exposed to the virus, or is it to keep daily new cases as low as possible? Which of these will inform the government's policy in releasing lockdown measures on business, bearing in mind that so far infection numbers have been low and admissions to hospital well below capacity?
Okay, I think that it's clear. I mean, whenever I get the daily results, I want them to be as low as possible. So I think that our strategy must be keeping numbers low. How we develop our lockdown policy will take that into account, but it will also take into account many other factors. I think at the early stages, when we didn't know what we seem to know now about the virus, there was a thought that, like with many other viruses, we would develop more immunity than it appears from the information we have up to now that we're developing. So there was a school of thought, which was perfectly legitimate at the time, that there was this herd immunity that we could get. If more people have it, you would get more immune, and therefore the virus would be finding it more difficult to find hosts to attack. Because we're not sure about that, because the immunity is not quite what people thought it was going to be, that I think has been put to one side. There'll be more research, and maybe this time next week there'll be more information which would mean that we go in a different way. But certainly what we're trying to do now, with all the measures we're trying to implement, is to reduce the number of cases. We know how to trap it. We know how we can stop the virus. We've been quite successful so far. Let's keep on at that. So that is the strategy at the moment.
The next question is from the Olive Press for Minister Cortés. There was talk of zonal parking being frozen from the end of April when permits run out. Can the Minister confirm this, and how will it work from here? Will the previous zonal permits be recognised as valid until further notice, or can anyone park there, or are the fees to be paid online via the government e-portal?
We have no intention of changing the zone system. There was a lot of controversy at the beginning, but I think people have seen how well it can work. At the moment, when we're not encouraging people to be driving all over the place, it's not the time to change it either. When it comes to renewal, obviously the whole of the government initiative in the future will be for electronic payment and for forms of payment that do not involve personal contact or transfer of cash. But all payment renewal details for this scheme can be found on the website on jibcarparks.com. So I would ask anybody to do that, to contact that, otherwise to contact the departments. At the moment, we're not envisaging changing that.
The next question is from the Panorama. The next stage of easing the lockdown has become a huge dilemma for governments. While in the UK, coronavirus cases appear too high to ease the lockdown, in Gibraltar's case, not only was the curve flattened, but practically wiped out. So why is it that the government appears to be mimicking the lockdown steps the UK is taking, when Gibraltar does not have the same COVID infection or mortality rate recorded in Britain, or can possibly be working to the same epidemiological COVID models?
We're mimicking no one. We're taking our decisions based on public health advice, our knowledge of Gibraltar. We're all contributing to this as a government, so we're mimicking no one. In fact, the conversation with Professor Heyman, which I referred to earlier, the meeting that we held with him, he was very complimentary of how we're doing things different and how things appear to have been working. Obviously, we cannot say we've practically wiped it out. We have had some extra cases over the last few days. That, I think, is a warning. Whether it's that we have maybe dropped our guard or not, these things happen statistically. You can get little peaks. Let's hope that's all that it is. But certainly we are mimicking no one. We've been successful because we took very firm steps very early on, particularly with the lockdown of the elderly, which nobody else, to our knowledge, has done anywhere else in the world. But the danger is lurking out there. We are not following anybody else's models. Models, after all, are just models. We look at all of them. We look at all the research that's been published, and we make our own decisions. So far, we've made, I think, correct ones. We will continue using this system as we go forward.
The next question is also from the Panorama. If serious lockdown measures are in place and being enforced, led by the police, to keep the spread of the infection as low as possible in Gibraltar, with the lockdown now further extended for a month, why are similar or more tougher measures not in place by having tighter controls at the frontier, where there are no quarantine procedures, and those controls that do exist at the airport also lack a system to enforce or ensure compliance, similar to those applied to the rest of the population in lockdown?
let's remember that what we have put in place has seen, and you said it yourself in one of the other questions, a flattening of the curve, an improvement of the situation. So, and that is as we are with the frontier and so on at the moment. So we haven't done badly in that respect. I think the other thing we must remember when we say we've extended it for a month, we've extended it for a month. The law requires us. This is a serious thing that we're doing. But we are reviewing weekly. So we must remember that things will change. Hopefully they will change and we will transition towards a more open Gibraltar. But obviously we have to be able to respond. We must remember also that the traffic through the border has reduced from about 35,000 a day just before this started to around 2,000, 2,500 a day. So that already has had an effect. We are looking at other measures, including temperature checks at entry points. In some places it's more practical than others. That is not a fail-safe. That may improve things a little bit, but it will remind people that this is a serious matter. And also, for example, arrivals in airports with tests perhaps becoming quicker. It may be possible to do that as this goes forward. At the moment, as I think one of my colleagues said over the last couple of days, it may have been the Deputy Chief Minister, the number of passengers arriving on flights is about 70. So that's not a significant source of potential infection. Ivor, do you want to add to that?
Yeah, I think that the other thing I'll touch upon is on the flow of people coming in and how that has reduced. And as an example today, we've seen that the FCO has updated its travel advice in Spain and making sure that people are not coming to Gibraltar to transit into Spain unless they hold residency over there. So there's been these extra measures that has actually stopped the flow of traffic that we had from the air, as was the case some time back. So we've really seen that being tightened up.
The next question is from YGTV for Mr. Lopez. Can you provide an update on the MOD chartered ferry that was set to bring medical supplies to Gibraltar as announced by the Deputy Chief Minister at the start of the month? What supplies are these and when will they arrive?
Yeah, the charter or the MOD RoRo that was available for us some time back. The issue was at the time that the equipment that we were expecting from NHS UK was not available just yet. That doesn't mean that we haven't had the equipment. It just meant that we had other avenues to bring medical supplies coming in. So whether that has been through British Airways in terms of air cargo, or indeed we know that the RAF A400M aircraft also managed to bring some of the supplies. So it doesn't mean that we have not received those medical equipment. It just means that we have other avenues to bring that in. So the RoRo that actually came a couple of weeks back, I think it was now, I think it was all about MOD supplies. But it was an option that was available to us. It's just unfortunately it didn't actually work out with the release from the medical equipment that NHS had at the time.
The next question is also for Mr. Lopez from the Olive Press. First up, I think the public recognises the great logistical effort the Civil Contingencies Committee has undertaken over the last 2 months. What have been the main challenges so far and how have you overcome them? And how long will this organisation need to stay in place to guarantee Gibraltar's safety and well-being? How can you foresee the future challenges?
In terms of the dates, it's difficult to know. Clearly, we are in the long run, I think, for this, as this will continue until such time as we are able to transition to a new stage. In terms of the challenges, I think, like everything, it's probably at the start when you need to have the setup, all the structures in place. But thanks again to the leadership from government in terms of getting everyone involved early on. That meant that those structures were very quickly put into place, and now it's very much working as it was an established government department. So by and large, really pleased with the way that everyone has actually chipped in and pushed forward with this as a team effort, which it really has been.
The next question is for Minister Cortes from the Chronicle. As part of the review of lockdown measures, are there any plans to relax the number of people allowed to attend funerals?
I think it's too early for that. This is obviously one of the things that we will have to review in coming weeks and months. We all know because we're such a close and tight community, we all know how, I'm not going to say we like going to funerals, but I think people know what I mean. We want to go and share those difficult moments with our friends and our relatives, and we have a lot of them in a community like Gibraltar. But those are ideal occasions for the virus to just, go all over the place and to spread. So I would not think that that is something we are going to do right away. But like everything else, as I've said, we are reviewing these things very, very regularly. We will do it as soon as we think it's safe. I would think that at this point in time, it wouldn't be safe to do so.
The next question is from YGTV for Minister Cortes. Does the fact that there have been 9 new cases this week mean that decisions to lift some lockdown restrictions will be delayed until you get a clearer picture of how quickly cases are increasing?
Not necessarily. As I say, we've had 5 cases overnight. It's been 9 in a week. This could be a glitch. So not necessarily. We consider all the information daily and sometimes several times a day. If we keep to the guidelines, we can still keep this contained. We need to monitor. I think the Chief Minister, in one of his interventions over the last week, reported on the Director of Public Health's recommendations and his 4 triggers as to when we could look at releasing some of the restrictions. And I'm just looking at my notes here. This was, the 4 triggers were cases rising by more than 6 per day. We've had 9 in a week, so that still doesn't meet that one. More than 6 admissions per day. We're virtually having no admissions. More than 2 cases in CCU. Fortunately, CCU is clear at the moment. And more than 25% in the over 70s. So even those triggers aren't met. This isn't hard and fast. We would have to monitor. I could be telling you something completely different in 2 or 3 days' time, depending on what we see. This really is a changing situation. I think the reassurance for the community and for ourselves having to take these decisions, and we feel the burden of responsibility, we don't take them lightly, is that we are changing, we are listening, we are monitoring, we are responding very quickly to everything that's happening in Gibraltar and around the world. So not necessarily at this point of time, but we have to keep under review.
The next question is from GBC. When government begins easing out of lockdown measures, this will likely bring a second wave of COVID. We know that St. Bernard's Hospital and Nightingale hospitals are well prepared for a surge, but what about additional equipment to help monitor patients in their own homes? Has any thought been given to purchasing items such as pulse oxygen monitors, which can be easily ordered online?
If we get a significant second wave, obviously when we release, there's more opportunity for that. But whether we get it or not will largely depend on how the community responds. If we keep on with the measures, then it's not necessarily going to come, but obviously the opportunity is greater. I think that, as you will say, or the questioner well says, we are well prepared. The hospitals have more beds than they've ever had in Gibraltar. And the monitoring of people who are positive at home is regularly done with phone follow-ups and so on. And there is communication between the people who are at home positive and the GHA. Whether additional equipment can be bought for use in the home, that really is a question more for the GHA, but I'll make sure that is asked directly to the GHA. It would be unfair for me to surmise because I wouldn't know whether medically that would make a significant difference.
And the last question is from the Chronicle. Given that you're planning a seek and destroy strategy involving contact tracing and aggressive testing as part of plans to ease the lockdown measures, are you already doing this with the latest cases? If not, why not?
I love the seek and destroy. It really, I wish we could find and destroy the whole lot of viruses. There is contact tracing. We are trying to do that more vigorously with all the experience I think that we have now, with all the other things, I say very likely, all the other things that Iva has summarized that has already happened. Now we can move to the next step. So contact tracing will be increased. We are working with a GIS platform to put in as much data as possible, so contact tracing will be computer generated much more easily, and that's one of the things that my colleagues in the Department of the Environment and Climate Change are doing. So I think it will become even more aggressive. Let's just hope we don't have too many people whose contacts we need to trace. But we are going to be doing this more and more.
Okay, thank you. No more questions.
Well, thank you. As I round up now, I think this week, probably for the first time, I said to myself, or when people ask me, how are you? My answer is, I'm getting a little bit fed up of this. I think many of you will know what I mean. We are human after all. And being human is what makes all this so difficult. We're a social species. We thrive on being together. In Gibraltar, we hug, kiss, shake hands. This thing is somehow depriving us of what makes us what we are and who we are. But then, think of what is still happening out there. How many tens of thousands have died? 20,000 in UK? More than 50,000 in the United States? Real people, many of whom would still be alive today if it were not for coronavirus. Then the sacrifice we're making, the yearning for social contact, for going out to the cinema, to the beach, all these sacrifices become worthwhile. We must not forget that this thing, this virus, is still out there, that we have contained it, but it is invisible and ready to strike back. Now, there is a better future ahead. We'll have learnt about our vulnerability. We'll have learnt about behaving differently, being more careful in social interactions, about keeping healthy. Science and medicine will, I am convinced, give us the tools to contain this and allow us to get back to much greater normality, a cautious normality, where we can all smile and hug again. So let's beat it. Let's not forget we still have work to do. So please keep to our advice. Stay at home. Wash hands. Keep your distance. When we start releasing restrictions, then is the time to be even more aware, even more wary, to be more conscious of distance, to wash hands more, to make sure you stay at home if you have symptoms and call 111. All this will be even more important soon when we start to venture out more and go back to work and then to school and then everywhere else. Please, we can beat this. The better we follow the advice, the sooner we can get out and live a more normal life, and the less likely it will be to then have to reverse. Make all that we have done so far be worth it. Stay home. Stay safe. Save lives. Remember the symptoms to look for: fever, a new cough, sore throat, fatigue or muscle pain, being unable to complete a sentence without snatching breath because you're short of breath, and possibly headache, loose motions, or a loss of taste, smell, and appetite. If you have these, call 111. For other COVID-related inquiries, call 200 418 18. If you are unwell with other things, don't neglect your health. The GHA is there for you too. Call 2000 7910. If you need a repeat prescription, don't hesitate. Call 2000 7909. If you have an emergency, call 190 or 199. Stay home. Stay safe. Follow our advice. As I said last week, together we can beat it, but not too close together, eh? Good afternoon. We'll smile soon.